Sometimes the political will to create change can rush in like a tidal wave. It can be bold and visual and undeniable. This has risks of its own, of course, but used deliberately and carefully, political will can solve critical problems quickly. I'm speaking to Dr. Angela Hilmers of the Task Force for Global Health, where she's a Director of Strategic and Technical Initiatives at TEPHINET, the global network of 75 field epidemiology training programs, strengthening public health systems across more than 100 countries. TEPHINET's mission is to develop, connect, and mobilize a global field epidemiology workforce to strengthen public health systems and advance health security. Hello, Dr. Hilmers.
Hi, Zainab.
When Zika hit Latin America, what was the greatest needs to contain this virus?
We had about 700,000 cases of Zika in the Latin American region and Caribbean regions, 200,000 of those cases alone in Brazil. At that time, we didn't have the infrastructure, laboratory capacity, enough competent personnel at the front lines. There was a need to quickly train, build laboratory capacity, understand more about the adverse effects of Zika, and do that quickly. Ended up training about 1,200 people. And by the end of 2018, Brazil was able to expand the training to 25 states, 5,000 municipalities. And I think that is a great example of ownership and being able to sustain the program afterwards. They saw the importance of training health workers at the front line. They saw the importance of understanding more about Zika and its adverse effects. We were able to roll out curriculum, train also the community. That was actually, I think, one of the greatest impacts at that time.
How did you work with countries to gain the political will to build this capacity?
You're coming to a country with funding, and you're offering support to a country, and you have the funding that is necessary to implement this initiative. It's not difficult, because you're offering the tools and even the knowledge and how this is going to be implemented. But you have to be very culturally competent to be able to tailor the idea in a way that it addresses the country priorities. It's not a one-size-fits-all approach, so we had to approach the ministries in a different way. You have to give them more ownership and power to use that model and tailor it the way they need.
Thank you so much, Dr. Hilmers.
Thank you, Zainab.